Hello everyone, I am Dr. Shadab Ahmed, consultant cardiologist at Care Hospitals, Alakpet. So today we'll be discussing a topic that is heart failure. What is heart failure and how patients develop the symptoms of heart failure, what are the causes of heart failure, and how to treat the heart failure. So heart failure is a common term used to designate any dysfunction of the heart muscle. So it leads to the dysfunction of the heart muscle and leads to decreased pumping of the heart. So when the pumping of the heart is decreased, it can lead to both backward failure and forward failure. So when the function of the heart is to supply blood to all the organs of the body. So when the heart pumping is decreased, it leads to decreased supply of blood to the various organs of the body like kidney, brain, and various other organs. Along with that, it also causes failure of it leads to increased pressure in the lungs, which is called as backward failure. So all these organs, the dysfunction of all these organs, it depends on the heart. So when the heart muscle is not working properly, it leads to symptoms of various other organs of the body. Like patients can develop common symptoms of heart failure like difficulty in breathing. So this difficulty in breathing can start suddenly or it can start slowly and whenever they are walking or doing some work, or sometimes it can start suddenly when they are at rest also. And the other common symptom of heart failure is swelling in the legs, which is seen due to dysfunction of the right side of the heart. So they can develop swelling in the legs and swelling in the abdomen also. So along with this, another common symptom of heart failure is fatigue. So which is normally ignored by many of the patients. So they can feel easily exhausted after doing even the normal activity. They can feel that they are drained easily and they are not able to do their routine work. So these are the common symptoms of heart failure. Another important symptom of heart failure is palpitations. That is, someone can, because heart has to work more when the heart function is disturbed, so they can have palpitations, that is feeling of one's own heartbeat. And this, even on a little exertion, they can feel that their heart is beating more. So these are the common symptoms of heart failure. What are the causes of heart failure? Most important cause of heart failure is someone developing a blocks in the heart, that is coronary artery disease. So someone developing a heart attack which was silent or which went unrecognized, that led to the muscle dysfunction, can lead to heart failure. Other important causes include viral infections or some bacterial infections which can affect the heart muscle, leading to myocarditis and heart failure. And other important causes of heart failure include during pregnancy, some patients can develop heart failure due to muscle dysfunction. And there are other remaining causes of heart failure which come under idiopathic dilated cardiomyopathy. So when someone develops such symptoms of heart failure, they should undergo two tests which are done commonly, which is the ECG and the echocardiogram of the heart, which shows the heart muscle dysfunction. So once the heart failure is diagnosed, we can go for the medicines and the dietary management. So the common medicines which are used to treat heart failure, they help in controlling the heart rate, they help in improving the muscle function, and they also help in decreasing the symptoms of heart failure by draining the excess amount of fluid in the body. And along with this, the dietary modification is lowering the amount of salt in your diet and lowering the amount of fluid in your diet. So once the heart failure is controlled with these medicines, and sometimes there are some reversible causes of heart failure which needs to be recognized and treated. And some patients who develop blocks in their heart, they should undergo angiogram test to look for any blocks in the heart and which needs to be treated, and thus lead to reversible in the heart failure. And sometimes when after all these medications and treatment, if the heart failure is not controlled, then the last option would be a cardiac transplantation. So these are the common symptoms and how to treat the heart failure. Thank you.